All right. Well, good morning, everyone. Almost afternoon. I'm LynnEdwards, and I'm at the Monroe County WIC program. And as of March 1st, I started working with the ADRC Monroe County Senior Meal and Congregate Dining sites. And in May and June, mostly May, I went over to all 6 of the sites and did a site visit and found out lots of stuff. One of the concerns was they hadn't had a dietitian for many years, and therefore there were some things that had fallen through the cracks. And so what this presentation is, and I'm not going to go through it and present it as I did to the sites because all of you know this stuff. This is more of an educational piece. You're more than welcome to take any of this PowerPoint that you want and turn it into your own. But these are the things that I found. It's just a combination of from all the 6 sites. And I went through it with all the site managers. July 8th, I think, was the date that I went through it. And so now what the plan is, now that I've gone through with all of them, we're starting new forms. We are going to, we've already implemented many of the things so far. And then I will be going back in, we haven't set a date yet. I'm waiting for the ADRC director to let me know. But sometime within the next 4 to 5 months, I will go back and visit all the sites again to see if the changes have been made and what questions they may have. So this is, and feel free to ask any questions at the time, or if you disagree with something that I've got here. My background is mostly nursing home consulting, and so the senior meals is new for me, although I did it once in Vernon County many years ago. I consulted for them for a short period of time. But, you know, sanitation is sanitation, and regardless, they all kind of, you know, roll into one. So here we go. This was the beginning slide, and if you want to advance. And then what the goals were when I presented this was to increase the understanding of safety and sanitation practices. We also reviewed the menu and policies and then addressed changes. And then last but not least, we went through site visits, best practices, resources, and had lots of questions and answers. Next slide. So goal number 1, increase the understanding of safety and sanitation practice, and we'll advance. I introduced the new temperature forms. One thing I found on many of the sites is that they weren't all using the same form, and so it's very confusing. And they had like little notes here, little notes there, and these new forms kind of capture everything. And I've already gotten July from the sites that this nutrition site manager had me review, and it's definitely a great tool to be able to use. Because you can capture things on the dates and seeing what's going on there. So if you haven't utilized these yet, be sure, and they're on the shared drive, right, Pam?
Yes, and I'll resend that link.
Okay.
Or maybe I'll put it in the chat. Thank you.
Okay. Next, please. And this is the back of that temperature form we just did. And this one does capture a lot of the information too, number of meals and whatnot on here. And then this way they're writing down ideas on the dates that, you know, they're looking at. Go ahead. Shortages, you know, what was happening too is that the site was calling the site manager, and then the site manager was calling the vendor or the caterer, and that's what we changed. That is that they now call directly to, in this case, the nursing home, and they have faster answers. The other thing that this is helping to prevent is that, let's say something was wrong in one site, they can correct it before they deliver the food in the next couple sites. And so this is going well now too, that we've made that change. Next. One thing that was interesting is that nobody was calibrating thermometers. And the problem is that some of them didn't know how to do it. Some of them they didn't have any ice, but they did have a freezer. but they didn't think that they should use an ice cube tray to make ice in order to, you know, help calibrate those thermometers. Also, one thing I found out that was interesting is that some of them are switching to the digital thermometers. They'll still have to be calibrated regardless, but one of the packaging said that it was lifetime calibration. And so one of them thought she didn't have to do it because it was lifetime. And so I educated on that, no, that only meant that they would honor that being calibrated if it did go off. And so if it wasn't in the range that it should be. So a lot of times you learn things, and so we did some education using, and a lot of this information I took off the information that Pam has on the SharePoint, which was awesome. There's a lot of information on there, and it's kind of overwhelming for somebody new, but some of these may help you if you haven't seen them yet. All right, next one. And, you know, you find things sometimes, like the first site I went to, they weren't using alcohol wipes, they were using paper towels to wipe the thermometers. And so then in a simple education process that's there. Next. No one was wearing hair coverings or beard restraints, and we went through what's appropriate, what can be used, and that in itself was an education and new for them. Next. Gloves were not always being used, and so we went through, or if they were being used, they were used inappropriately. So for example, once they put those gloves on, and some of them didn't even wash their hands before they put the gloves on, so they were putting the gloves on and then wearing them throughout that shift, or would have, I should say, had we not had discussions. But yeah, so the right way to use gloves, I said if you're washing your hands, you have to do it in between tasks, and that you don't need to wear gloves if you've got tongs, you don't need gloves and a tong. You can use one or the other. So lots of education, and again, this fact sheet is on the link is on the site there too. Next. Hygiene and cleanliness, we went through the basics of this. And what I also provided at these site manager meetings is actually hard copies of things so that they could put them into a notebook and a binder and use them. So each site would have it. Next. Examples of the taking the temps of and not all of them were doing it of the juice and the fruit. They weren't sending an extra so that this could be done. And so then again, another education piece. Next. First aid kits. This one was marked really well. I took a picture of it just because, you know, if somebody was new or if you had a sub that was in there that didn't work as often and they needed a first aid kit, you could easily identify this. So we did go through first aid kits, and now we've made sure that every site has a first aid kit because there was only one or two that did. Next. Cooler and freezer, shelves cleaning, expiration dates. There were a lot of things that we need to address with all of this. One of the freezers at one of the sites, it was like well, it was an upper lower type of freezer, and when I opened it, it was a one-door freezer. I opened it up and it was full of ice. I mean, packed on there. It had to be that way for who knows how long. And so when I asked, I talked about what happens when this freezes up and the impact it has on the equipment itself, and how temperatures can change as a result, and so on, all the things that you all know. But and when I asked who cleaned it, they didn't know who cleaned it, so nobody was cleaning it. And so it's good to have policies in place that who's responsible for doing what, especially when these are in like a Boys and Girls Club, or if they're in a fire station or whatever. Clear policies need to be in there, and who's responsible. Even like watering plants came up on who's responsible for doing that. So there's a lot of things to take note of and clean, and making sure that it's being done, and who's checking it and such, and cleaning the shelves and checking, for expiration dates. Next. Washing your hands, that's a basic, you would think, but that had to be done because not everybody, you know, some people were washing, but maybe not for long enough. We talked about singing the happy birthday song. And then some of them were shutting the water off after they had taken the time to wash their hands. They shut the water off with their clean hands instead of taking the towel and turning it off that way. And so just simple education. And I think what we need to remember with everyone is that we can't assume anything. We need to make sure we're doing the education for people. All right, next, please. And making sure that the hand washing sink sign was there and it was missing in most of the sites. Next. This is a good handout on the share site, just definitions of things. Especially, I think the one that was most important was the difference between cleaning and sanitizing. Next. One of the things in these sites that I went to, there was only one that had a 3-compartment sink for the washing, rinsing, and sanitizing. And some were only using a sink, you know, it's one of them was like, I don't know, decades, years old sink. That's only, you know how they used to make them where they weren't very deep, and pretty much the faucet almost touches the sink. And if so, they were using the hand washing sink and the supposedly 3-compartment sink that they should have had there, and they didn't know any better to not do that. And so we ordered gray tubs to compromise for the washing, rinsing, and sanitizing. We also ordered red-green buckets and gave education on that. Some are using quat and some are using bleach, and so I provided education on both. Eventually what's going to happen is I did go into the storeroom here at the county, and there's so much waste in there. There's so many products, and some of it had to do with COVID because of, you know, you couldn't get certain products, but this had been a practice going on for some time. And so what we're going to do is develop, and mostly when I say we, but it's mostly the nutrition site manager, will be developing a form. So when they order like a clean, it'll either be bleach or a quat. It'll be one or the other. It'll be a certain cleanser and so on. And so everybody will be using the same. That way the education is the same. And if somebody has to go to one site or another, you know, things are being done the same. It's more uniform. So there's definitely a lot of changes that will be beneficial to everyone. And, you know, some people were liking their household cleaner that they used and maybe went and bought it. But the problem with that, as you know, is there's no SDS on it. It may not be appropriate for food service and such. So a lot of things that we are learning as a result of these site visits. Okay, next please. And then we went through how to mix in the testing. And one of the things I pointed out too is that the sanitizer does work best if it's between 75 and 120 degrees Fahrenheit. You know, if the temperature of the water is not within this range, what's going to happen when you take that strip and you put it in there, it's not going to read correctly. And it can also be less effective if it's mixed at a lower temperature. So this is good for, you know, anybody to use in regards to the strips and the temperature. And if it's a chlorine at a higher temperature, it can also corrode certain metals. Next, please. And this is just some quat tips in there, so we can move on. Okay, so condiments. What I found is that some of the, you know, like in a refrigerator, you know how they have those bins for fruits and vegetables? Some of them were full, almost to the top of condiment packages. Some were all mixed up with ketchup and mustard and mayo and tartar sauce and whatnot, all within the same bin. And some of them, I found this one that was marked, it just had ketchup in it, but it was from 2000. And this was like in June, and this is March. And usually the best practice is that condiments, if you don't know the date, should be thrown out within a year. One of the things that I've used in the past, and that actually I got a lot of compliments from Joint Commission from doing this, is that we put the condiments in a bag with the date on it, and anything not used within a year got thrown out. And so it's a matter of at least for safety is having a plan regardless of how you do it. So this is just what we are going to do. And hopefully there shouldn't be too much extra, because we've changed also the condiments on the menu. Those were not on the menu prior to me approving the menus, and now they're on there, and it tells you how many each can have. And so we should have less waste on the condiments themselves and should be avoiding the stockpiling. Next, please. We also talked about laundry, who's responsible for it, where it's put. There was a lot of inconsistency in this part, and so that's more that the ADRC director will be addressing. Next. So this was a big discussion, the use of the microcores. What one of the sites was doing was taking them and putting them in a roaster to get them heated up for a meal, and that actually decreases the life of them and can increase the risk of a fire, and it's not recommended to do. So Pam did go, I think you addressed one of the vendors, right, Pam, and got the directions from them directly. And so we're no longer putting them in the roaster. They should not be put in hot water either. They actually should only be used by microwave. And I think the ones that were using them by microwave were doing them longer because they thought, more is better type of thinking. And so therefore there's changes in this and how they can be done. One thing that was not addressed that I asked the question about is how are they sanitized, because we have not been sanitizing them. And so there's directions on here on how they should be sanitized, and also the chart depending on the size of your microwave and how long they should be done for each, and the size of the microcore itself. All right, next please. The hot and cold bags, they were on the floor, they weren't being cleaned and sanitized. I found a couple of them in the refrigerator, and when I asked about them, I said, are you cleaning and sanitizing these? And they weren't. And so therefore what they were doing is that they took it from the floor, or they put it in their car or wherever, and then they were putting it in the refrigerator, and none of that's were cleaned or sanitized. And so we had to go through, how to do it, how it should be done. Now you have to do the inside, the outside, the straps, the handles. They should be not be put on the floor. They should be put on a cart that's been cleaned and sanitized as well. Also, making sure that each site has the adequate amount of bags, because what we did find out, and what I did too when I did the site visits, I actually went with the staff to deliver the meals, and that way I could actually talk to each of the clients there to find out, how are they satisfied with the meals? Are there any changes and that type of thing? And so that gave me a lot, lots of information to help with looking at the menu and what changes we may need to look at. So that was a invaluable opportunity as well. One thing too is that I found with going with one is that she had her own bag, and it was very worn out, and she kept it, and she has animals, and so that was kept in the back. And so, we have to look at that and saying that, employees can't use their own bags. We have these for a reason that are cleaned and sanitized and that can be used. So, all right, next please. Boxes and refrigerators and freezers are not recommended. The reason being, there's a little pest on there, a bug, is that a lot of times these boxes, from their source of where they are being delivered from till they get there, and if they're on a truck waiting or whatever the whatever it may be, is that bugs can be in boxes. And so it's good to empty those as much. And I think like from a, and I don't know what Wisconsin has, but I know like in healthcare, you can't have any more than 10% of your stock inventory in boxes because of the bug and pest control concerns. All right, next slide, please. Eye wash stations. The main thing with this is that most of them did not have it, and they all have it now because they've been ordered for each site. But the other thing that I emphasize with this is that they need to look at the solution date, because they do expire, and you want to make sure that those are part of the checklist. Next, please. Fans, and you've probably all seen this. These are not good fans because you can see the dirt on these, and these were being used and blown, and they were on countertops, which means they're going directly on the food. And so there are policies in place addressing this. Next, please. Chemicals, and I already talked about how we're downsizing and going to one form in that, but you can see all of the different products on the one there. Some were making their own. I put the X on it, and the different, and they didn't have, none of them had strips, chlorine or quat strips in any of the sites when I was doing my site visit. Next, please. Storage of mops and brooms, they should be on a rack hanging up so that when you're mopping in that, that you don't have those to interfere with. So things should be off the floor. Next. SDS manual. There is an SDS manual, but it's here at the county and at none of the sites, which doesn't help the sites. And so that is what is being worked on right now, is that every site will have their own SDS binder. So that's a work in progress. Next. We talked about fire. None of the sites had pass signs, and so these were printed off and placed by each fire extinguisher with the education. Next. Goal number 2 was to review the menu and policies. We did make changes. There were lots. They were missing probably several fruits and vegetables a day, and the protein needs and the whole fiber. We looked at the whole menu and updated it, and there's so much. In fact, we're getting so many compliments, and we're getting more people that have signed up for the meals as a result of the change in menus. So that's such a positive thing that we're happy about. Next, please. Just talked about dates, rotating. They were sending these breads, but they didn't have any labels on them. And so that was a point of discussion. Next. One thing we found too is that each site used different cups, containers, and lids instead of everybody using the same, which is better from a cost control containment. And so we will be switching to that, to everybody using the same. And one thing to keep in mind too is that at one of the sites I found that they were using it's like a 12-ounce cup, you know, that you like to get a soda in, and the lid was one with a straw. They have a straw hole in it. Well, it was leaking. I mean, why would you put, and this was put on like peaches or pears or whatever, so it's too big. And then you've got that type of a lid, and then and now it's, so that's been discontinued now. So little things, some good things that come from a site visit, and that was another one that was there. Next, please. I don't think that just shows the butter. Next, please. We talked about the condiments, and we're giving one packet. They can actually, you know, ask for more. Leftover food, there's policy in there you can find out. And that's printed directly from the policy. And the part in red is potential change coming on that. Next. And about taking food home. And I'm almost out of time. So, and milk, we have now offered soy milk and lactose-free milk, which wasn't being done. And so we've made that change that's there. One thing that was happening is that they were giving them a milk and a juice until they were missing out on the calcium. And so we're trying to give feedback to encourage the milk or calcium, and that there's other ways to use it instead of just drinking it. Next. Fresh fruit, you know, anything fresh fruit. So I had them pick out which two of these need to be wrapped in like a plastic wrap or put in a sandwich bag. And obviously it's the apple and the peach or the nectarine, because those are something you're going to bite into. So they should be covered when they're sent with the bag, with the meal. Oranges and bananas do not need any type of a covering because you're unpeeling them. So this was new for them to start this process. Next, please. And we can go past that one. That's just a casserole changed. We reviewed the use of spoodles, ladles, scoops, leveling them out. I actually watched that, and because they were making not level portions, and therefore that increased the cost of that meal. Next. Dishwasher, dish machine rinse test strips were not being used. Some of them do have it right on the machine, but I think it's only 2 or 3 of them. And so those strips have been ordered and now they're being recorded. Next. We went through some best practices. Next. And then about the, you know, what's going to follow up the site visits, which we already talked about. So next. I also reminded them the bulletins were really outdated. They had stuff on there from, some of them were like I don't know, 10 years ago. So to make sure that the information they have posted is all up to date, and make that a regular practice to look at that. Next. And I know Pam is working on this catered site information. And next, please. There's one. Next, yeah. Next. So try to be a rainbow in someone's cloud. I always like this. I like the picture along with it with Maya Angelou. So it's a learning, and you know, people were very receptive to the changes. It's because they didn't know, and so it's an education. So I apologize I went over there, but there was a lot to cover that was found out. So hopefully it was helpful in some way for each of you, that you'll find a slide or two that you can use in your own, at your own site. And thanks for your time.